I'm Dr. Estelle. I'm going to just be talking to you a little bit about my journey into dentistry, why I got into dentistry and sort of how the years progressed. So I really decided that I wanted to study dentistry when I was about 14, which is pretty early for most people. Most people don't really decide until they've done their A-levels or have done a little bit of work experience. Reason I started, loads of people say, why did you want to be a dentist, Estelle? And it's really difficult to put like one finger on why you wanted to do it, but I went on work experience just randomly to my local dentist and I really enjoyed it. Like I saw the way you would be able to talk to people all day. I love that, I love chatting to people, so it really suited me well. And then also the sort of science element I was really interested in biology, so you were able to tie that in. And really it was the human side of dentistry plus the science really like that combined that drew me to it. I did a whole week work experience there and really thought, this could be something that I want to do long term. Applying for dentistry, you do sort of need to have a little bit of a structured approach to it, especially with your applications and what experience you've got to go into it. For that, work experience is really key. My work experience, I did that initial week at my local dentist, and then I did another week when I was doing my A-levels a little bit later on. I think going back to it was really key, the same place or even somewhere different, but just making sure you've done like a few different sort of places or you've gone back to the same place to make sure you really want to do it, because this is what you're going to be doing essentially if you do the degree. Lots of different parts in dentistry, but just like you want to do sort of the basic side of it, or just being a general dentist as well. It's really important you want to do that if you're going to go and do a 5-year degree. So I went back, did another week, and then I also did a week at St. George's Max Back, so in a hospital setting. That was really useful, just because it showed me, progression. You could go and do Max Back, you can go and work in a hospital, and also sort of the different environment and like comparing and contrasting them was really useful. And then I also did a week's work experience in an orthodontist, that's braces. That was really good as well, again for career progression and specialising, and also just seeing what was out there and if I liked other things around dentistry in general. For that, so that was all the work experience I did. That's really important. Obviously at the moment in post-pandemic, it's a lot harder to get work experience. So I would, as things open up, that might come back. Obviously there's limited numbers allowed in dental surgeries at the moment just for people's safety. But there's also different things. A lot of places doing virtual work experiences. I know like through unis are doing that. So doing like taster sessions, so you can just get an idea if you want to do it. Also for my works, for my personal statement, I made sure that I was really early getting that in. Loads of advice, just get as much advice as possible on personal statements. I think mine was drafted about 13, 14 times. So a lot of work went into it, a lot of different opinions, just getting as much as possible. That was through teachers, through other dentists, things like that. Really important to start that early and get that in for the early deadline. Other things I did, you have to showcase your manual dexterity. So for that, I play a musical instrument, but there's so many different things there. Sewing, musical instruments, some sports as well, things like that. There's so much you can do for that. That's really not just important for your personal statement, but important for, just have you got the skills really. They'll teach you all the things you need to do in dentistry, but having a good idea of how well you are with your hands is so important before you embark on that career. Other things, I did a lot of extracurricular stuff. So I was in my medicine society at school. I also founded a dental society at my sixth form, which was useful. That was again just being able to do talks on dental related things, helping other younger students. That was a really good experience as well on like leadership and things like that, which are really important in a dental career. Once I got in, so I studied at Peninsula, which is in Plymouth. That's right down by the coast. It was really nice in summers, beach trips, surfing, things like that. It was fab. Really sort of progressing all the way through. We do a lot of clinical stuff. It's really hands-on, which is fantastic. So really enjoyed that. But I think what really helped me in dental school was being really organised, definitely. So organised with your notes, organised with like what dates coming up for assessments. That was a key part, I think, of progressing well throughout the years and being able to qualify. You don't really want to be last minute scrambling around for deadlines, not also because it's going to not benefit you to pass your exams, but just sort of benefit your learning and you taking in that information that you're going to need in the future. Other things were getting as much help and advice you have so many clinical tutors, so many big brains there to ask, and I think I'm a big believer in don't ask, don't get. So asking was so important about, can I come and see this? What do you do for this? Nothing's a stupid question. So really important. And I graduated last year in the middle of a pandemic, which was really interesting, but I'm now nearly at the end of my dental foundation year. That year's been fantastic. So really good, like, supportive environment. You have a lot of trainers, a lot of study days. So that's a fantastic experience as well. And then yeah, just going on really with the rest of my career, which will be fun. So I'll keep you guys posted. I think advice for people with trying to decide if dentistry is for them, I think it's getting as much exposure as possible. That's the only way you're going to decide it's for you. You can, ask people for their opinions. You can ask people, they might love it or they might hate it, and that's their opinion and they're not you. So getting the most experience, definitely, and most exposure to dentistry.
Thank you so much.
That's all right.